Well, hello. All right, so let's go back to talk a little bit more about some respiratory drugs, and I'm just going to talk about in general bronchodilators. All right, we talked about the antihistamines, and so now specifically bronchodilators. All right, so these are adrenergic drugs, and I told you that the antihistamines and the adrenergic drugs end in either OL or INE, and the antihistamines were the INE. And so now we're at the bronchodilators or the adrenergic drugs that end in the OL. So to talk about this drug category, we really need to assure that you fully understand beta agonists and how that effect really works. All right, so we talked about histamine before. Now we're talking about the beta agonist. So we have both, if you remember, beta 1 and beta 2 receptors. And do you remember where they are? Well, beta 1, this is the way that I have always remembered it, makes it really easy. Beta 1, or B1 for the beta, receptors are in the heart. You have one heart, beta 1. Beta 2 receptors are found in the lungs, so beta 2, 2 lungs. 2 lungs, 1 heart, beta 1, beta 2. That's the easiest way I can tell you to keep those two separated and remember those in your head. All right, so these drugs work by dilating smooth muscle, and they're specific due to the beta adrenergic effect of the drug. So the short-acting beta agonists work really quickly, like 3 to 5 minutes, but they may only last like 4 to 6 hours. So the effect, is not long, but it is a really quick effect. These are the drugs that you see most often given to as that quick reliever and to relieve, immediate symptoms and bring really quick relief to people that are having trouble, breathing. So a short list, and there are many, many more, of course, listed for you in your book with full information about them. But under short acting, albuterol, metaproterenol, I cannot speak this even, terbutaline, but there's several. There's a whole list of those in there. Be sure that you look at those for the short-acting list. And then we have the long-acting. Long-acting, and then we also have some combo drugs as well. But the long-acting are the ones that, they're newer drugs that are out, and they're drugs that are meant to not be used as often, but they have a longer, effect. So maybe 12 hours or up to 24-hour effect on these. So the short-acting bronchodilators are usually delivered by like inhalation, and usually they're more like as-needed PRN type medications versus on a regular schedule of medications. Anticholinergic drugs are another group of bronchodilators that are different from the beta agonists. While the beta agonists affect the bronchioles, which are the tiny or smaller airways, the anticholinergic effect of the muscles around the bronchi, or on the large airways. When the lungs, become irritated, these bands of muscle, they tighten and the bronchi narrow. So the anticholinergic drugs work by stopping the muscles from, being able to tighten. There are two kinds of anticholinergics. Those are the short-acting and long-acting, and they are delivered either by inhaler or nebulizer. And of course, the difference would be the short-acting medications work usually about 15 minutes onset, and they last for about 6 to 8 hours. Some providers don't consider these drugs as the relief medications, like the bronchodilators I just mentioned earlier, because they do take longer to work than those beta agonists. In other words, instead of 3 to 5 minutes, we're looking at about a 15-minute onset here. Conversely, because they are good bronchodilators with less side effects than the beta agonist drugs, some believe that these drugs should be given should be the main drug given in the treatment of things like COPD. So we don't have it has less side effects than those beta agonist drugs. So with COPD, you also run into people that have other, disease processes and things going on. So they tend to be a better drug. But be sure that you look into your book where they have lists of these and all, because I'm just giving you a few basic things off the top of my head about these drugs. So there is To date, there's only one long-acting anticholinergic drug available, and it takes about 20 minutes to work, but it will last about 24 hours, and so therefore, it only has to be taken, one time a day for a maintenance dose. It is usually inhaled. An inhaled capsule is what form it is given in. So side effects and what kind of things do we see with these? With anticholinergic medication, doesn't seem to have as many noticeable side effects as the beta agonist. The side effects that are experienced include dry mouth, blurred vision, and if the spray comes in contact with the eyes, that's where you get that blurred vision. Worsening of glaucoma, a dry cough. Men with prostate problems might see an increased difficulty in urinating. So just a few things to keep in mind with the beta adrenergic drugs.